Hello friends, it's Carla, your online doctor with today's Live in 5. Today is Thursday, December 17th, and it is 5 p.m. So we started talking on Tuesday about needing mental health professionals on the COVID task force moving forward. And I wanted to continue a little bit on that talk about mental health. New reports found 1 in 5 COVID patients, specifically in rural areas, develop some form of mental illness within 90 days of recovery. Now, this report was published in the Lancet Journal. So it's a legitimate article, but they talked about it and they said the mental health issues or illnesses included anxiety, depression, insomnia, and post-traumatic stress disorder-like symptoms. So for people with COVID on quarantine or hospitalized who are not allowed to have visitors, the lack of contact with family or friends can result in psychological instability. And for those discharged from the hospital, obviously that PTSD is very, very common because of the nature of the illness, right? That we're talking about something that has people pretty scared, all right? The report claims 32% of patients had PTSD or could be diagnosed with PTSD, 15% developed depression, and another 15% had anxiety. So the numbers are significant. Now, the PTSD symptoms included post-intensive care syndrome. Okay, for people who went into the ICU, there is a syndrome associated with that, and that included cognitive, psychological, and neurological symptoms. Now, researchers are also finding a higher incidence of dementia in people who have had COVID. Now, it didn't specifically say if that dementia is limited to the elderly or if it's across the board. I'm thinking it's more likely in the elderly or older population, just by the nature of it being dementia. But again, it was not specifically mentioned in the article. Now, this article is concerning as someone who lives who lives in an urban suburban type area with access to medical care at every turn. Every corner that you turn, there's a hospital or a clinic or a doctor's office, right? We often don't think of rural populations unless, of course, you live there. So in general, access to medical care could be miles away, maybe even hundreds of miles away. But rural areas already have a deficiency in mental health care providers and facilities compared to big cities. So any additional burden of mental health problems on top of those that already exist will make this gap of cases to care that can be offered is going to make that gap even larger and make it kind of stand out even more. Now, the truth is COVID-19 has and continues to affect the mental health of many, even those who have not had the disease. Okay, being one of them, many of my friends who've not had it, we're still dealing with issues, right? The unpredictability of the pandemic in general, the associated lockdowns of family members, physical distancing, and so many other issues have increased the risk of mental health problems. Now, the report, that article noted increased symptoms of depression, anxiety, and stress. I mean, stress is just like rampant, right? As a result of the life disruption, fear of illness, fear of negative economic effects brought on by COVID-19, including phobic anxiety, panic buying. I mean, who hasn't noticed that in terms of, people hoarding supplies, binge watching television. I mean, stop watching the media, right? That's associated in and of itself with mood disturbances, sleep disturbances, and fatigability. But then there's also the increased risk of drug and alcohol use that is being seen due to the pandemic. So while many hospitals and mental health facilities are turning to telehealth appointments as a solution, it may not be right, not only for mental health in general, where you maybe have a better experience if you have a relationship, if you have a pre-existing relationship with your psychiatrist or a psychologist or whatever, you may be able to transition to telehealth, but new patients, that's a big challenge, I would think. But also in rural areas, that cellular connectivity and access to technology is not the same. I mean, we've all driven in areas and you just lose the internet, right? You just can't use your phone. There's just no connection, right? So it's very, very different when you're dealing with areas that are not as populated. So clearly anticipating the needs now as we move forward will facilitate closing these healthcare gaps sooner than later, because it is a problem now and is going to continue to be a problem over the coming months as we move, head like full force into this pandemic, and hopefully coming out the other side in 2021 earlier than later, I hope. Just things to think about. Okay, so if you have any resources or connections or anything, or people that you know are going to need help, start looking into it like yesterday, because it really needs to be addressed. On that note, I hope you're having a wonderful day, and I will see you again on Tuesday for another Live in 5.